Hello people, namaste. In this video we will discuss about the herpes zoster ophthalmicus. Herpes zoster ophthalmicus. It is caused by herpes zoster. It is caused by herpes zoster. Herpes zoster is also called shingles. This generally herpes zoster virus causes chicken pox. This chicken pox, see, this causes chicken pox. How, where it lies after the recovery? This herpes zoster lies in the ganglions of fifth cranial nerve. Generally it already, what is it, it is in the dormant state. It is dormant stage of ganglion in fifth cranial nerve. So first we should write the etiology. What is the etiology? Means what is the causative organism? Is herpes zoster virus. First causative organ. Next it is a DNA virus. Okay, it is a DNA virus. It is neurotrophic in nature. Next we should discuss about the pathogenesis. What is pathogenesis of herpes zoster ophthalmicus? In children, I discussed, see, in children childhood, when the chickenpox came because of herpes zoster virus, after the recovery, this virus is present in dormant stage of ganglion of fifth cranial nerve. When the person decreases the immunity and the person has immunity is depressed in like AIDS, TB patients, this undergoes reactivation. This virus undergoes reactivates in the fifth cranial nerve of ganglions of fifth cranial nerve. It leads to two types of lesions, like cutaneous lesions, skin lesions, and this ophthalmicus of the ocular lesions. It leads to ophthalmicus. We are discussing about the ocular lesions. So herpes zoster ophthalmicus. Before this, generally we have some clinical profile, like what are the clinical features are present, like this herpes zoster ophthalmicus. Generally, see, this is the fifth cranial nerve. What is called fifth cranial nerve? So trigeminal nerve. Trigeminal nerve has three layers, like first one is ophthalmic, maxillary, mandibular. Okay, this ophthalmic has again three layers, like first layer is lacrimal, frontal nerve, and nasociliary nerve. Frontal nerve is the most common nerve involved in this herpes zoster virus. But because of this herpes zoster, the ophthalmic movements will be stopped. Why it is stopped? Because of this nasociliary nerve undergoes affect of nasociliary nerve leads to ophthalmic movements, means ocular movements undergoes affective. Ocular movements undergoes affective because of affecting of nasociliary nerve in the ophthalmic. Most common nerve involved is frontal nerve in ophthalmic branch of trigeminal nerve. These are the important points. Next, another important sign is there, Hutchinson sign. This is very important. Mainly they will ask what is Hutchinson rule. Hutchinson rule means generally in herpes zoster persons, herpes zoster virus infection persons having the nose present, no, this nose undergoes the tip of the nose having vesicles. This imply the side or tip of the nose present the vesicles. In herpes zoster virus, the tip of the nose having vesicles. So this is the Hutchinson rule. What is Hutchinson rule? Means the tip of the nose having vesicles, the nose involvement in this herpes zoster. And this herpes zoster virus has one side in the face, one side having the vesicles, another side is normal, and one side having the involvement of vesicles. Lesions are only limited to one side. Lesions are limited to one side only. And Hutchinson rule is present. It is the tip of the nose is involved in the herpes zoster virus. These are some of the important points. Okay, next clinical stages are present. I will discuss about the clinical stages. Okay, clinical stages are three types of stages: acute, chronic, recurrent or relapsing stages. Acute means less than few weeks and more than years, and relapsing means after the years it undergoes relapsing, like 10 years after that years it undergoes relapsing. First we should discuss about the acute. Okay, acute has divided into three stages, like prodromal stage means early stage. Prodromal means early stage. Next, eruptive stage, Next, ocular lesion phase. All these are three phases comes under the acute stage. First, prodromal. Prodromal, early infection. What we can see? Fever, malaise, neurology, and pain will be present. The person having fever, okay, malaise, and some. It involves the nerve now. So neurologic pain, which is severe. Neurologic pain will be present in severe. Okay, this is the prodromal phase. Next, eruptive phase. First stage is prodromal. Next, eruptive phase is some lesions. Eruptive means cutaneous lesions like this. Lesions will be present. Eruptive phase means cutaneous lesions. What are the type of lesions? First one is maculopapular lesions. First, macules and papules. It undergoes vesicles. After that, vesicles formation. Vesicles lesions. Vesicular formation will occur. Next, pustule formation. First, maculopapular. Next, vesicle formation. Next, pustule formations. Next, crusting. After the formation of pustule, crusting ulcers will occur. Next, after the ulcer, it undergoes regression. No, depigmented pitted scars are present. After that, ulcer undergoes scar formation, depigmented pitted scar. So first of all, what are the in eruptive stage means it is a cutaneous lesions. First with the person having maculopapular rash. After that, vesicles formation. Next, pustules formation. Next, ulcer like crusting ulcer, crusts are formed, crusting ulcers are formed. Next, depigmented pitted scars are present. These are the comes under eruptive stage. Next, we should discuss about the ocular lesion. This is the important phase we are discussing about herpes zoster ophthalmicus. First stage is conjunctivitis. In conjunctivitis, we can see some of the points like mucopurulent conjunctivitis. In the persons having mucopurulent conjunctivitis, acute follicular conjunctivitis, and severe necrotizing membrane conjunctivitis. First one, what is the first one? Herpes zoster ophthalmicus has in acute phase we have in three phases like general. First one is prodromal, it was called general phase. Next, eruptive phase, ophthalmicus. Ocular lesions is first one is conjunctive, involves conjunctiva. Conjunctiva is mucopurulent conjunctivitis, acute follicular conjunctivitis, necrotizing membrane, severe necrotizing membrane conjunctivitis. Okay, this mucopurulent, when the mucopurulent is associated with pH means peticle hemorrhages are present in mucopurulent conjunctivitis. Acute follicular conjunctivitis with LA means lymphadenopathy. If the person having acute follicular lymphadenopathy along with the acute follicular conjunctivitis having lymphadenopathy. If the person having a mucopurulent conjunctivitis along with they have a pitted peticle hemorrhages, peticle hemorrhages, and the one is necrotizing membrane inflammation also seen in the conjunctivitis. Necrotizing membrane inflammation. So these are the two types of conjunctivitis seen, mucopurulent conjunctivitis and acute follicular conjunctivitis. It has in peticle hemorrhages along with acute follicular having lymphadenopathy. So next, first ocular lesion is conjunctivitis. Next one is keratitis, zoster keratitis. This is the important keratitis. Zoster keratitis has four names like epithelial layer, epithelium keratitis, nummular keratitis, disciform keratitis, keratouveitis. So we should discuss about the zoster keratitis. So in zoster keratitis, first one is epithelial keratitis. So epithelial keratitis have seen. These are the diagrams of epithelial keratitis. This is the diagram of one side only, face one sided only. It involves a one sided lesions and the tip of the nose involve the vesicles called Hutchinson sign. So in this video we will discuss about the zoster keratitis. First one, epithelial keratitis. Okay, epithelial keratitis. So in epithelial keratitis, first epithelial keratitis. What in epithelial keratitis we have two types like punctate epithelial keratitis and the dendritic epithelial keratitis. This is called punctate epithelial keratitis. This is dendritic epithelial keratitis. See, punctate epithelial keratitis, which is followed by dendritic epithelial keratitis. Okay, punctate epithelial keratitis is followed by Dendritic epithelial keratitis. In this herpes zoster ophthalmicus, no bulbs are present. They have no bulbs, but in another herpes zoster, herpes simplex virus, they haven't bulbs are present. In this, no bulbs are present in dendritic keratitis. Next one is numblar keratitis. Numblar keratitis. In this, we can see the heel form scars. Numblar keratitis means tiny granular deposits surrounded by hollow of stromal hairs. See, these are the tiny granular deposits surrounded by the hollow of stromal hairs. At the stroma, it is a stromal hairs. These are the tiny granular keratitis. These are surrounded by the stromal hairs. This is the nummular keratitis. Next, we can call next disciform and keratouveitis. Disciform. This is the 50% cases disciform keratitis like this. They are present as a only total disc involved. Disciform keratitis. Next, keratouveitis. It is the endothelium is a favorable site. Keratouveitis with endothelium. This endothelium is the favorable site for keratouveitis. So these are the zoster keratitis. I discussed the acute, chronic, relapsing now. First I discussed the acute. In acute I discussed the three phases like prodromal phase, eruptive phase and ocular lesions. Prodromal means first stage, fever, pain, severe pain and malaise. Eruptive phase, cutaneous lesions, cutaneous maculopapular lesions, pustules, vesicles formation, crusting ulcer formation. After that the depigmented scars formation. After this, these are the eruptive phase. Next, ocular lesions phase having conjunctivitis. First conjunctivitis, two types of conjunctivitis. First one is acute follicular conjunctivitis. Next one is mucopurulent conjunctivitis. Mucopurulent conjunctivitis with pedicle hemorrhages present, and acute follicular conjunctivitis with the lymphadenopathy is present and has a necrotizing membrane also present in this conjunctivitis. Next, zoster keratitis. Zoster keratitis, discuss the four names. First, epithelial. Epithelial has two types like punctate, superficial punctate keratitis. Next, it converts into dendritic keratitis. Next, nummular keratitis means at the disc, they are the small tiny granules deposited around the surrounding by halo of stromal hairs. Next one is disciform. This is the disciform keratitis. Next, uveitis. Like what is this uveitis? Keratouveitis. It involves the morely endothelium. It involves only superficial endothelium is a favorable site. Next, I discussed the ophthalmic. I discussed the conjunctivitis and zoster keratitis. Others are episcleritis, scleritis. All these are present, not that much important. You should remember like episcleritis, scleritis, also iridocyclitis, RA and secondary glaucoma, and anterior segmental and necrosis. Others are present. Okay, more important one are conjunctivitis and zoster keratitis. Zoster keratitis has epithelial has two types like superficial, disciform, nummular keratitis, disciform. This is what is this? Dendritic. This is dendritic keratitis. Okay. And keratouveitis. These are the important other infections are episcleritis, scleritis, iridocyclitis. All these are if you remember you can write. Okay, next one is associated neurological complications. Some neurological complications are there. See, herpes zoster has motor nerve palsy, sensory nerve and encephalitis. Some complications. Neurons, no. What are the complications? First one is encephalitis. Encephalitis rare, generally rare. First it involves the sensory nerve and motor nerve of trigeminal nerve. Okay, sensory nerve. Sensory nerve means sensory complications like optic nerve. Optic neuritis will occur. Because of optic nerve, it leads to optic neuritis, 1%. Because of motor nerve palsy, leads to 3rd, 4th, 6th, 7th cranial nerves involved. Associated neurological complication. Neurologically, some complication, not only trigeminal nerve. There are motor nerve like 3, 4, 6, 7, and sensory like optic nerve, like it leads to optic neuropathy, and encephalitis is rare. This is some of the bit points, not that much important. Okay, next after the acute phase we should discuss about the chronic phase. See, chronic phase is it is very easy. Chronic phase, see, should discuss about the chronic phase. Chronic phase is called post herpetic neuralgia, which is important. Neuralgia, post herpetic neuralgia. See, post herpetic neuralgia, what is this? The pain, severe pain will be present in that. After the eruptive stage also they have a pain. See, in acute phase I discussed here pain only, there is no pain in after eruptive stage, only prodromal stage having pain. But in that chronic, after the eruptive stage they have a persistent pain. Eruptive phase subsides, after the eruptive phase subsides, eruptive phase subsides, still pain continue in chronic, means post herpetic neuralgia, still pain continues. It should be increased at night time very, it should be worst, right? If there is an heat, it should be increased. If we touch, it should be, the pain should be increased. Night heat touch, the pain should be increased in these conditions. Next, what are the chronic, what are the points comes under this chronic stage lesions? See, the given pain is intensively worse at night and aggravated by touch and heat. All these are present. See, it may persist for years with little decrease in intensity. There may persist for years. Okay, there occurs some anesthesia of affected skin. When the anesthesia of the affected skin, which when associated with continuous post-herpetic neuralgia, is called anesthesia dolorosa. Anesthesia dolorosa. Okay, this is called anesthesia dolorosa. Next, we should discuss about these types. What are the types? I will draw the diagram. You should remember that. This is the eye. You should not draw in exams, for remembering only. They given the lid lesions. Some lesions are present. Lid lesions, because of at the chronic post herpetic neuralgia, lid lesions are present. Lid lesions like scar, like ptosis, all these are present. Ptosis and lid lesions have scar, ptosis, scarring, notching, all these are present. Notching, mainly scarring are present, and scars, ptosis, sometimes ptosis is present, and notching is present in lid lesions. Next point is conjunctival lesions, mucus secreting conjunctivitis. See, because of this conjunctivitis will occur. Conjunctival lesions. Conjunctival lesions are present. Lid creases, conjunctival lesions. Next one is corneal lesions. Corneal lesions are, first one is, this is the cornea. Okay, this is the cornea. See, in this mucus plaques keratitis, plaques are formed. Plaques, mucus plaque keratitis, mucus plaque keratitis is formed. Next one is exposure keratitis. This keratitis undergoes exposure keratitis. It leads to dry eye. Okay, exposure keratitis. And the one is neuroparalytic ulceration. Because of this keratitis, it leads to ulceration. Neuroparalytic ulceration will be present. Okay, these are the corneal lesions. What are the corneal lesions involved? First one is plaque formation. Next one is exposure keratitis. This undergoes keratitis. This leads to neuroparalytic ulceration. This is mainly because of seventh nerve palsy. Seventh nerve palsy leads to neuroparalytic ulceration. These are the corneal lesions. Next, uveitis, scleritis also occur. Uveitis and scleritis, all these occurs in chronic conditions. So chronic conditions are post herpetic neuralgia. It is eruptive phase subsides, the pain still continue and worse at night, and increased intensity by touching, by at the heat conditions it increased, and also it leads to lid lesions. Lid lesions like what are the lid lesions? Like scars, notching, ptosis will occur, and conjunctival lesions also occur. Corneal lesions like plaque formation and exposure keratitis. Next, neuroparalytic ulceration occur, and uveitis and scleritis, all these are occurs in chronic stage. In next video we will discuss about the other treatment, other this, and another one is relapsing stage lesions are also present. After 10 years only these relapsing will occur. Next video we will discuss the treatment. So before that video we will discuss summary of this herpes zoster ophthalmicus up to The clinical stages. First, you should write the because of fifth cranial nerve, involvement of fifth cranial nerve of ganglion. Okay, etiologies varicella zoster. Okay, it is DNA neurotropic in nature. Pathogenesis, children chickenpox will come off. It will be dormant stage. It will be present at the ganglion of trigeminal nerve. After decrease in immunity, like TB, HIV cases, it reactivates and causes the cutaneous lesions, ocular lesions. Hutchinson rule, tip of the nose involved is called Hutchinson rule. Is this herpes zoster virus only strictly limited to one side of the midline of face or head. This trigeminal nerve has three layers. This one is ophthalmic. In ophthalmic, frontal part is most common. If nasociliary is affected, ocular movements will be affected. Clinical stages 3 like acute, chronic and relapsing. Acute few weeks, chronic has years, and relapsing reappears for every 10 years. Okay, first we should discuss about the acute. First one is prodromal stage, means fever, malaise, all this pain will become. Eruptive stage means after the cutaneous lesions like maculopapular vesicles, pustules, crusting ulcers, depigmented pitted scars will be present in eruptive phase. Next, ocular lesions. First one is conjunctivitis. Conjunctivitis, two types of conjunctivitis: acute follicular conjunctivitis and mucopurulent conjunctivitis. Mucopurulent has what is that? PH means pedicle hemorrhages. Conjunctival follicles with lymphoid adenopathy is present. Next is after this follicular conjunctivitis. Next, zoster keratitis. Zoster keratitis, epithelial, nummular and disciform keratouveitis with endothelium. Epithelium has superficial. Epithelium has punctate epithelial keratitis followed by microdendritic epithelial which does not have bulb, so it is called pseudodendritic keratitis. Next, nummular keratitis which have a small disc surrounded by the halo of stromal haze. Next, disciform. Next to keratouveitis is generally involve the endothelium. Okay. Next, other points like episcleritis, iridocyclitis, all these are points comes under ocular lesions. Next, chronic stage having post herpetic neurology, eruption phase subsides. Still pain condition, nighttime touch, all these are present. Okay, see, after the post-herpetic neuralgia, lid lesions are present. Conjunctival lesions, corneal lesions like plague, exposure keratitis formation, and neuroparatic ulceration, uveitis, scleritis also present in this chronic phase. Next, relapsing stage lesions which occurs even after the 10 years. It leads to relapsing stage lesions. In the next video, we will discuss about the treatment of this herpes zoster ophthalmos. Thank you. Please subscribe my channel. Please support us. Thank you.